Welcome back to another episode of Rehab Now, brought to you by the Rehabilitation Institute of the Caribbean, Winchester MRI, Immune Active Denk, and Almighty Studios. Today we have Dr. Paula Dawson, our rehabilitation medical doctor. She's a consultant physiatrist. Put some respect on her name. And I am your host, Alicia Taylor. Welcome, Doc.
Thanks, Alicia. Hi, everyone.
So this week we're going to be discussing knee pain. Make sure to check out our social media pages. That's Rehab Institute Caribbean, Dr. Paula Dawson, Alicia Taylor Music, and on Facebook, Rehabilitation Institute of the Caribbean, and our website, rehabcaribbean.com. Today we're going to be talking about the knees.
The knees.
And your knee bone connected to your
hip bone, and your hip bone connected to your knee bone, and your knee bone connected to your ankle bone, and you hear the word of the Lord.
And you bend and you bounce back, dry bone and you da-da-da. Whoa, come right through. Today we're talking about
Rehab, not
knees.
music.
Okay.
It kind of did sound like a little music
feel
show.
like
Alicia Taylor, ladies and gentlemen, vocalists.
Feel like a music show a little bit. But let's get back into the frame of things. So the knees are another part of our bodies that are put under quite a bit of pressure. So let's get into the matter of the knee and treating knee pain. I have a new question.
What's your knee question? You have not knee?
Yeah, man, I'm not knee, and I'm a knee question, but I do have
Genu valgus.
Yeah.
You know how to spell it?
No.
Spell it, man.
Genu.
Yes.
Man.
Valgus.
VALGUS. No.
Star. Move to the front of the class.
Genu valgus. And the bow-legged people are called the what?
Genuvarum.
No, that doesn't sound good. That have no ring to it.
It has no ring.
But the Genu valgus, it sounds buzzy.
Not knee. Yes. You see the knee? I love the knee. And it seems like I love every part of the body.
You do.
I love the back. I love musculoskeletal medicine. I love rehab medicine. I love life.
Yeah.
Hallelujah. Yeah. You see the knee? The knee is an interesting thing because unlike the back, not everyone will have knee pain, but a lot of people have knee pain. And so knee pain can be pain when you sit for long. That's the sad thing. When you're sitting for long.
Me.
Knee pain when you stand up to walk. Knee pain when you're going upstairs or up an incline or down an incline or downstairs. And so there are different parts of the knee. So let us, before we even get into knee pain, let's talk about the structure itself.
Of the knee.
The moiety. That's a word in medicine, the moieties.
What's that? What that mean? Can I use it in any other discipline?
It's like the moiety of the architectural design.
Ooh.
Yeah, moiety. So the moiety of the knee. So the knee.
Moiety of me. Can you say that? No?
I don't think so.
Okay, fine.
So the moiety, the structure of the knee. So the knee is a joint, a hinged joint. Like, you know, when you open and close the door? Hinged joint.
Wow.
Yeah, man. Unlike the hip, which is a ball and socket joint. Yeah. Right. And so the knee is a hinged joint. So it should only go in one direction. Flexion and extension.
Flexion, extension.
Right. And so the bone that comes in the thigh, that's the femur. And it hinges on the leg bone, which is the tibia. And so that is one joint, but there's another joint in the knee. Yeah. Because a joint is where bones articulate, is the kneecap, which is called the patella. So where the patella...
All these words.
The kneecap...
Okay. You could have done that all along? The kneecap. Thank you.
The kneecap is called patella. So the kneecap, where the kneecap articulates, meaning hinge across.
Thank you for that. Because I'm thinking articulate as a singer and it's just not...
Yes.
What
English language is amazing.
Isn't it?
Articulate is when you speak clearly.
Right.
But articulate in medicine is where you... articulate, where you move through. Yeah, so articulation.
Right.
Interesting.
All
That's
right.
a good one there. Anyway, so where the kneecap is and where the kneecap articulates or hinge across the knee, you have another joint. So you have the joint between the back of the kneecap and the bones behind it, and the joint between the thigh bone and the leg bone, right? So let's talk about the knee. So when you have knee problem, you want to know where the knee pain is coming from. So in between the thigh bone, which is the femur,
okay,
and the leg bone, which is the tibia, you have a cushion. You have two cushions called the meniscus. plural, menisci.
Menisci.
Right, and so meniscus, medial and lateral meniscus, they're the cushions. And if you didn't have that, you have bone on bone, you have grinding, and it's very painful.
Yeah,
So when you have arthritis, one of the things is that the meniscus them in Jamaica, how you pluralize. In Jamaica, how you pluralize
The
things.
meniscus them.
The meniscus them.
Plural and plural, that's how we do it.
You
Yeah.
put the them on the singular. So the menisci, they will lose the height, and so you start articulating or you start rubbing bone on bone. In addition to that serves as cushion, you have the cartilage, which is the lining of the joint. So the cartilage, like gristle, you ever eat chicken? You ever eat a chicken leg? You see that nice little whitey cap on the chicken leg? That's cartilage. You're eating cartilage.
We're eating cartilage?
I love gristle. Collagen.
I realized you like to God, the food and the
I know.
the bones.
But we're all
It's-
animals, you know.
matram.
We're in animal kingdom. We're not plants, so we must be animal. Well, but they're two kingdoms. You never go to science class.
Nobody at school that day, you know, when they not teach the kingdoms.
I am
Wasn't there.
animal and plant, so we're animals. So we're not animalistic, but we're
But we are. I get what you mean.
yeah,
It's
right.
okay, I get you.
Why are we rich over here, so?
I don't know.
Anyways, let's come back. So let's come back to the cartilage, right? So the synovial. So the cartilage is almost like the capsule of the knee joint.
Oh,
so you
that
have
makes sense.
cartilage around the end of the thigh bone, which is the femur, and the top of the leg bone, which is the tibia, and also on the back of the kneecap. And all those are important. Why? Because it allows everything to glide nicely. When you start breaking down the cartilage, that's when you start getting rubbing bone on bone, and you might hear some little kum in your knee.
It's the music for me. Music in my knee. Okay.
And so we have those. Those are the shock absorbers, or the things that allow the bones to glide nicely. And in addition to that, you have ligaments that stabilize the knee, right? And so you have one on the inside called the medial collateral ligament, MCL, and the lateral collateral on the outside ligament, LCL. And then you have two in the middle that make a cross, and they call it a cruciate. That's why they call it cruciate, anterior cruciate ligament and posterior cruciate ligament, PCL
yeah, man.
and ACL.
Wow.
So you
I'm
have
following.
these. So these are just ligaments, right? And so essentially what ligaments do, as opposed to tendon, ligaments join bone to bone, create stability. Unlike tendons attach muscles to bone. And so that's important for you to understand.
Okay.
And so if you have an injury to the knee, it could be a ligament injury. You could tear one of those ligaments that stabilize the knee. You could tear the meniscus. You could chip off your cartilage, called a chondral defect.
Painful.
Yeah, you can get a little chip off. You can rub down the knee. But in addition to that, there's some other structures around the knee, more before we even get to the knee pain. So the tendons insert around the knee. So you have the hamstring tendons in the back, and then the quadriceps tendon in the front,
The knee is so interesting.
and then the patella tendon. So a whole heap of tendons and whole heap of ligaments and the meniscus and the cartilage. And then you even have some bursa, something called BURSA. These are like cushions that help with friction.
Okay.
So the tendons will glide past them, and you can get... You ever hear what bursitis?
Yes, I have.
So a bursitis is an inflammation of a bursa, and a bursa is just a cushion that allows proper gliding. So you can have
So your burst.
bursa inflammation, yes.
Right,
yes,
of
yes.
course.
So that's the anatomy of the knee.
Interesting.
And so with that, you can have a whole heap of problems in the knee.
I have a question. I don't know if I'm going ahead of myself.
Yes.
But remember, we're talking about... okay. So the question is...
Yes.
When we're bending to pick up something,
Yes.
we're not supposed to use our back.
Should not.
We should use our knee.
Bend with the knee.
Does that contribute to knee pain? Because we always have to be bending with the knees.
Well, it does not necessarily contribute to knee pain, because
Okay.
providing your knee, and I like that question, you know why? Because knee pain can come about when there's improper alignment of the knee, which is probably why your knee hurts when you bend, because you have the knock knee. What does that mean? So you have the kneecap, and the
Knock knee. Go ahead.
So all right. So when you have a nice aligned knee, it's in a nice straight line, right? And so the kneecap will glide between the bones in the femur. It's supposed to glide in a little track. But when you have knock knees, it glides off.
You mean my genu valgus?
The genu valgus. It either it glides to the inside or to the outside. They call that maltracking. A lot of young people have that, especially women. Patellofemoral syndrome, they call it. Maltracking of the patella. So the kneecap tracks off and you get pain right behind the kneecap or to the left or to the right of the knee, in the front of the knee. So it's not inside the knee. It's not at the side of the knee, and it's not at the back of the knee. It's pain in front of the knee. Patellofemoral syndrome.
So what about the people then with bow legs?
They can get it too, maltracking. So the
Okay.
tracking goes off. It's like a bow. So
Yeah.
you have to be straight for the kneecap to track.
So people with straight foot is straight knee, them okay?
Usually, because you can have straight foot people. But I love medicine. Let me tell you something about the knee now. You can throw off that line from your foot. So the alignment can be determined by how you plant your foot. So if you plant your foot and your foot turning, like you have flat feet, it can cause torsion of the leg and the kneecap can track off. That's the lower chain, kinetic chain. Or you can have problems with the hip, like if the pelvis is weak, the gluteus medius muscle, and when you weight bear, it dips. You can have maltracking and it changes what we call a Q angle. I kind of sound too technical. All right, so
Everything we are say, but okay.
the important thing is the kneecap has to track through a little groove. And anything that pushes it to the left, the inside or to the outside will cause it to maltrack. So if your foot turn in or turn out, you can shift the movement in the knee. If your hip turn up or turn down, it can shift the movement in the knee. And this can cause knee pain.
But it's not my fault. I have knock knee.
No, but guess what? With stability, with strength in exercise, you can train the quadriceps muscles to help the knee cap to track properly.
What you saying to me now?
Exercise.
Oh God, that word here again?
Yes. So the wonderful thing about and that is only patellofemoral syndrome. We don't even talk about meniscal injury on the inside. We haven't spoken about arthritis. We haven't spoken about ligamental injury. We have a whole lot more things to talk about the knee.
A lot about the knee, and I'm very excited because I have a lot of knee pain.
We can fix that at the rehabilitation.
Hey!
And we'll send it to Winchester MRI to get an MRI if you need it, and boost your immune system with immune active Denk.
I like that.
Yes.
I like that.
Yes.
When we come back, we're going to talk about how we boost our immune system, and if we need an MRI, where we go, and how we tackle our knee pain. So stay with us.
Yes.
And we're back. If you're just joining us, we're talking about genu valgus.
We're actually talking about the knee.
I know.
Don't confuse
but
them.
I learned a new word from a knock knee.
Genu?
Genu valgus.
Spell it for them.
GENUVALGUS.
Spelling bee.
Whoa,
That's
whoa,
correct.
whoa. Can we get the noun? I'm sorry. I'm kidding.
Can you use that in a sentence?
No, I
Alicia
cannot.
Taylor has genu valgus.
Yes, that's it. I'm sorry. Great. So we're talking about the knee. And while we were on the break, Doc and I were discussing theater
Knee.
Theater knee.
Theater knee.
Yeah. If I'm not running ahead of myself, tell us what theater knee is.
Right. So Alicia was saying that she gets knee pain when she sits a lot. And so some people will say, but if I have knee pain and I'm not weight bearing, I'm not standing, I'm not walking around, why is my knee hurting?
Yeah.
And that's called theater knee. So what happens is when the kneecap isn't tracking or going through the groove, and when you're sitting down, it's supposed to sit nicely in the middle of that groove. When there's a maltracking issue, it sits off of the groove. So it sits on the tip of one of the, we'll call the condyle or the pointy part of the thigh bone. And so after a while, it starts burning a little. It starts aching. So you have to straighten your knee to just kind of drop it back in the groove. And they call it theater knee because, when you go to movie theaters, you can't really stretch out your leg. All right? And so people, especially when you can call it airplane knee, because that's why tall people always want to sit at the aisle so you can stretch your knee out. And so with patella maltracking, which you can get, especially if you are climbing downstairs. So like about last year, I decided that I was going to do P90X, but try to get fit again. And I started doing a lot of pliers, the jumping. And then after a while, my knee started hurting, which is why I developed patellofemoral syndrome. I haven't recovered. That's my excuse why I'm not exercising right now. Wow. But I say that to say that a lot of jumping, walking downstairs when you're going downhill. A lot of people go to mountain springs and they have a lot of pain when you're walking down the hill. In fact, people walk down the hill backwards or walk from side to side because when you're coming down the hill, you contract the quads a lot and it kind of causes more pressure on the kneecap.
That makes perfect sense. That's why they used to tell us when we're in their country,
Yes.
When you go down there, no, walk sideways, walk sideways. Yes. I just couldn't understand. Yes. I didn't know what it meant, but now, wow.
Country people know what I'm talking about,
They do, even if they don't know the science behind it. They know what they're talking about.
Yes. And I just want to put a plug for magnesium because Denk also sells magnesium, but I'm talking about magnesium because magnesium is one of the new panacea supplements. It fixes everything. And magnesium is in Epsom salt. And so when your grandmother used to say, soak your foot in the Epsom salt.
Are you serious?
It helps relax your body. It helps your pain. It helps a lot of things.
That's good stuff. I always wonder what this Epsom salt, what this mean? It's kind of weird, but it makes sense now.
Right. And so the knee. So we were only at the outer structures of the knee. We're talking about the patellofemoral syndrome. And with that, you can also get the tendon which connects the quadriceps muscle to the patella called quadriceps tendon. You can get quadriceps tendonitis because it's a tendon. And then there's another little part of the tendon that connects the kneecap to the leg bone called the patella tendon. You can get patella tendonitis. And then young children, young boys in particular, can get something called Osgood-Schlatter, which is just where the patella tendon inserts into the thigh bone. They get a little bump. It can be quite painful. It gets swollen, especially when you're going through growth spurts. Osgood-Schlatter, Osgood-Schlatter.
You go, doc.
Even if I spell it wrong, you wouldn't know.
No, how would I? How would I know?
You could check it afterwards.
But, okay, so this concerns me because I have a boy.
Yes.
And he's growing. He's going to be really tall.
Yes.
So
it's usually they usually have it about 10, between 10 to teens when you're going through growth spurts. Now, how do you prevent it? To ensure that the quadriceps muscles are stretched. So you start having tugging and pulling when the bone is stretching and the muscles are not stretching along with while they're growing, which is why it's always important when you're going through growth spurts to help your kids to stretch properly. Really? Yeah, once you maintain the stretch, because remember, when you grow, it's the bones that grow and the muscle grow along, but the bones usually lead, which is why when you're growing, you can get tight. Little kids can get quite inflexible. Wow. As well. But we still in the front of the knee. We're not get to the inside of the knee yet.
I don't know if we're going to reach far with the knee. This is interesting.
I know. But before we go inside the knee, I want to let you guys understand that you can get maltracking if you have flat feet. So you need arch supports. So which is an arch support, which is something to help to position your feet back into the neutral position as opposed to when it's turned in, called pronation, right? And so that's another thing that we have to consider.
That's good.
You want to go inside the knee now?
Yeah, I'm sorry. I'm still at the foot. Wow.
Yeah, the biomechanics, they call it kinematics. It's the kinetic chain that goes from the top to the bottom.
Because I have a friend, she's flat-footed. But every time we have to walk a long stretch, she can't do it.
Because
it's very painful.
Pain in her feet as well as her knee, probably, yes. Wow. Yeah. And then that's another thing. We probably should do foot pain because you can actually bring back what they call the windlass. You can strengthen the intrinsic muscles of the feet and bring back the arch. Not a lot of time you can do
arch,
that. You do?
Yes, I do.
Yes.
I have a dancer foot. That helps me? No?
It certainly does.
Okay, great.
We help the genu valgus.
Man, a little advantage.
Little advantage. Right. And so that's the anterior part of the knee. And then let's go inside the knee because you always hear people talk about may have a meniscal injury. What is meniscal injury? It's that cushion, which is the meniscus, not meniscus them. the meniscus, and they get injured. And because they're cartilage, just like when you're eating chicken bone and you see the cartilage
There's
crack.
a chicken bone again.
I'm trying to show you what the cartilage is like. It
It
literally
helps.
is white and it's kind of plasticky, but it's nice and cushiony.
It's the same like the chicken leg.
I'm
seeing
similar,
this chicken. Yeah.
similar to the, but it's a two free floating structures inside the knee, and it acts to serve as a buffer or a shock absorber. And so any one of those can be injured. So, which is why you hear people say, I have surgery for my meniscal injury. So that can cause a lot of pain as well. And swelling in the knee. So patients complain of pain and swelling. And when you get a new meniscal injury, especially when you're playing football, the knee can lock on you. So just at the point of the injury, the meniscus might just slip a little and the knee locks. And so it's locked in a particular position, not for very long, and then it unlocks.
Oh, that's painful, isn't it?
It's very, very painful.
God.
And then, meniscal injury, research has shown that a lot of times they have surgery, but some meniscal injury can actually go on without surgery. When I used to live in Chicago, I was on a swivel chair, and I got up from the swivel chair and I actually injured my left medial meniscus. And up to now, I don't do an MRI, I don't do surgery. I know it hurts, but there's something called a bucket handle tear where a piece of the meniscus, this is my own diagnosis of myself without an MRI,
Wow.
I think it lifts up and it lifts back in. And so when I feel a little funny pain, I just flex my knee and I feel like I put it back in place and I go on again. That's just me. But if you have knee pain and you think you have a
you need to
meniscal
go to
injury,
Winchester MRI.
go to Winchester MRI to get your MRI.
Yes, you really
and go to a doctor. Oh, no, me, no, man, I'm good. I'm good like gold. Even run half marathon after that. Wow. And of course, we can't forget arthritis. That is the most common thing. Arthritis in the knee. Anything, when you have weight bearing of the knee, you wear down the cartilage, you wear down the meniscus, you now start having bone spur, you have bone or rub on bone, you can get arthritis. And then any one of these injuries, you can actually inject the knee. I tend to inject the knee with corticosteroid. You get a cortisone shot and patients get better. But it won't last because you still have to do your own rehab.
Okay.
You have to do rehab at the
Rehab Institute of the Caribbean. But how long you have to go through doing this rehab? For yourself.
I
have to do every day.
Love that question. So physical therapy, you may not need it for a long time. You may need 2 sessions. You may need 3 sessions every week for 6 weeks. It all depends on the degree of your injury and how compliant you are with what the therapist give you to do. You have to be compliant. You have to move. Motion is motion. You have to move to move. If you don't move, you won't move. And so sometimes, depending on the degree of arthritis, therapy can help. Of course, the same modalities, a shock wave and ultrasound and the shortwave diathermy, all of those fancy treatment machines that we use can also help. But then you have patients that end up needing surgery, and you can do a total knee replacement where you take off the tip of this is where the orthopedic surgeons coming.
Man.
These are some amazing guys where you remove the end of the thigh bone and the leg bone and you put a little metal, titanium. They're so amazing. And then you get a knee replacement.
Knee. You can replace your knee.
You can replace your knee, you can replace your hip, you can replace the discs in the back, you can replace your shoulder.
When you think you've heard everything.
And you can replace one of those little bones in the ear.
When you think you've seen it all.
Yes. You can
replace your knee.
You can, man.
I am done.
Knee replacement is quite total knee replacement. Very, very common surgery done here in Jamaica by a lot of orthopedic surgeons. We call that almost like, and the patients after they do it, they can actually go back to play tennis.
Whoa.
So
it's only when it's really, really bad.
When it's really bad.
Yeah.
So again, with musculoskeletal medicine, you always have to go through the algorithm. You try the rehab, which is the therapy, home exercise, lifestyle. And what kind of lifestyle would cause you to always have knee pain? Say you're a Tyler and you're always kneeling. You understand? Or you're sitting down and you don't get up. Or you do a lot of walking. Postmen don't really walk nowadays. You remember first time you have the bag on their backs?
Man.
Yeah.
But them used to ride bicycle too,
Very good.
Yeah.
And so that can help or hinder as well. But, you have the rehab, medication, injection, which I do, and surgery. So that is the algorithm for treating knee pain. Now, before we leave off knee pain, I want to make a a plug for, not a plug, but to let you know that sometimes your hip arthritis can refer to the knee and you think you have knee problem.
Oh.
So hip arthritis will refer
the body.
loin to groin, or it can go down into the knee. Or you can have a disc problem in the back. It refers to the knee because knee is L3 on what we call the dermatome, and L4, which is the lumbar spine. And you can actually have a herniated disc in your back and you feel it in the knee. So it's referred pain. So it's all about that. Why are you looking at me as much?
No, because this is fascinating stuff. I mean,
Oh my goodness.
so if you so then in that case, if you treat the pain in the back, then the knee pain goes away.
Good girl.
That's what I mean when your knee bone connected to your hip bone.
Yeah,
you know what I'm
man.
saying?
And so
yeah.
it's a good thing to understand, which is why as rehabilitation specialist and physiatrist that I am, the history is important. The examination is important. So you have to do a detailed history, a detailed examination. And if you need to do any radiological tests like an MRI,
You go to
you go
Winchester
to
MRI.
Winchester. But of course, you have to ensure that you examine the patient properly and make a proper diagnosis and you're not missing anything. And we still don't get to the back of the knee yet because you can have, at the back of the knee, you can have a cyst, something called a Baker's cyst.
A Baker's cyst.
A Baker's cyst. So the knee is lined. You have a nice lining of the knee because there's fluid in the knee that is, we call synovial fluid, which is kind of moving and it's keeping everything nice and lubricated. And sometimes that sac or membrane, you can get an out-pocketing and then it gets filled with fluid and it's, at the back is called a Baker's cyst, right? And so that Baker's cyst can be very painful. The Baker's cyst can actually rupture. And if you're light skinned, you can see black and blue down the back of your calf. That's the best thing for it to is to rupture because, it's very painful and then it goes away. And then you have different bursitis that you can have around the knee. You can have one on the inside where the hamstring inserts called the pes anserine bursitis. And on the
names.
I know, right? And then on the outside, you can get something called runner's knee because your iliotibial band, which is the band that goes from your hip all the way down, is tight. And the knee, I didn't even realize that the knee had so much. I thought today would have been an easy topic.
No,
we don't
man.
even touch some of the other things in the knee yet.
No.
Yeah. Yeah, man.
But tell me some of
Yes.
the groups that are at risk for knee pain.
I like
and does that group, I'm sorry, I had to ask.
Yes.
And does that group
Yes.
include tall people?
Well, yes and no.
Okay.
Right. And so your height doesn't necessarily put you at a
risk.
increased
Okay, great.
more risk of having knee pain. It's just your musculoskeletal, your balance and how you balance your body.
I just need to know
And
that.
so athletes are prone to knee injury if they don't have the proper technique. Weekend warriors, which are people like, well, not me or you.
It's okay.
People who
I don't feel
exercise.
bad. I don't feel bad.
Elderly persons with arthritis, But, the knee pain, it responds well to treatment.
Okay. And that's very good to hear.
And I didn't even mention gout, which is like crystal deposition in the knee of goat crystal. That's another thing that can cause knee pain. But we'll do a session on goat itself.
We need to
yes.
do... I feel like the knee,
Yes.
like more need.
The knee need more.
Your knee need more.
Yes.
Needs more.
Knee needs
But the
more.
more is not going to be today, unfortunately. Because we got to go. We're out of time. I can't believe it.
Excitement.
Thank you so very much, Doc.
You're welcome.
Always insightful. Thanks to everyone for listening. Power 106, our show producers, Renee, Stacy, and Jeff. Our engineers, thank you so very much. And of course, our sponsors, the Rehabilitation Institute of the Caribbean, Winchester MRI, Immune Active Denk, and Almighty Studios. We will see you all next week.
Bye. Blessings.